Let's get 2 minutes on the clock and your time starts now. All right, time is up and let's get through some answers. So lots of things that can be done. And I think probably one of the most important things is to actually make sure that staff have completed some form of cultural awareness training. We do hold a lot of unconscious and unintentional bias. And I think one of the easiest ways to start picking on that is to actually go through some cultural awareness training. And I think, funnily enough, it's often the people that kind of say, oh, we don't need to do that, that probably need it the most. Now, of course, ensure the practice environment is welcoming. This sounds like a silly thing, but having a space that's warm, that's caring and looks pleasant is something that goes a long, long way. Placing flags or art in the clinic, so having, and that should specify, that Aboriginal or Torres Strait Islander flags or art in the clinic. Developing educational materials, pamphlets, posters, flyers, those kinds of things that highlight Aboriginal and Torres Strait Islander people's health, and of course engaging with local elders to explore what the community needs. That way that can spread word through the community as well as inform the clinic what they actually need to be doing. Because it's nice to say that we want to improve health, but without knowing what the actual troubles are that you're supposedly targeting, I don't think you're going to get very far. So we've got some great answers through here with Demir, fantastic. So displaying the cultural imagery, and if you ever attempted to put the EG flag, feel free to just put flag. Try not to, but starting again, the risk you're running there is overcoding. So they might say that you're trying to give two answers there, and so you're probably better off just hedging that and putting one or the other. Ensure the practice is enrolled with the practice incentive program. Fantastic. Again, if I'm being really, really picky, avoid the abbreviations, but I know in real life you'd be handwriting that out. And again, providing cultural safety training for staff. Well done. SB, I'm going to be really mean for a second and say that you've got photo community elder, fantastic. And in practice, these are all things you definitely would do. Aboriginal Torres Strait Islander flag in the waiting room, Aboriginal art in the waiting room, all very, very valid answers, but you've fallen for a trap of not diversifying answers enough. And so really all of those things kind of tie into the same kind of group, as you just said in the chat there. And so I think while they're all good things to do, it's kind of different ways of saying the same thing. And it's frustrating as well because I know that the answers here show that ensure the practice environment is welcoming probably does have a lot of overlap with things like place flags or art in the clinic, but they do target things slightly differently. Otherwise, though, all sensible things. And again, this is one of those areas where I don't think it's people's clinical knowledge that mucks them up in the exam. It's the knowing the game of the exam is as much that gets you through as knowing the right answers. So the AKT is aimed at testing your clinical knowledge. The KFP really is about the game. Hate to say it, it is what it is. That's why I do these sessions. Of course, we've got more questions. So let's get 2 minutes on the clock and your time starts now. No, it doesn't, because I'm having IT issues tonight. Let's try that again. Let's get 2 minutes on the clock and your time starts now. All right, so time is up. And as I can see one answer in there, gosh, what a question. And I know that looking at it, you might say, oh, come on, that's not going to be in the exam. Guess what? Things that impact clinical practice, questions like this, the more kind of admin side of things, it's fair game. And questions like this have been in actual exams. And again, having a few of these kind of structured approaches to work out, well, okay, think about it from square one. What would we do if a new patient were to come in? How would we pick that up? That kind of thinking, that kind of process can come in handy for a whole bunch of different scenarios. And so, as has been readily identified very appropriately, ask the patient directly. Like most things in medicine, if you don't look, you don't find. And the easiest way is to say, hey, does this apply to you? And you'll be surprised sometimes, things like gender diversity, for example, or sexual practices, things that you may feel a little bit uncomfortable doing can make a massive difference in terms of patient care. So again, don't look, don't find, just do it. Ensure there is documentation in the medical record of Aboriginal or Torres Strait Islander status. This can be in the registration forms, as has been put in by SP, as well as in the software as well. There should be a space for it, and it should be flagged that if it's empty or not filled, fill it. Train your staff to be confident about explaining to patients the reasons for asking. Sometimes if staff are asked to ask potentially confronting questions, have a script prepared to actually express what that is can be incredibly useful. Encourage open communication for self-identification during patient interactions, and display educational posters in the waiting area to promote the importance of cultural identification. Where did these answers come from? From the 5 Steps Towards Excellence in Aboriginal and Torres Strait Islander Healthcare from RACGP. So, yep, hate to say, this is fair game. All right, of course, we have another question here. So let's get 2 minutes on the clock and your time starts now. right, time is up and answers are up as well. Now, if you're not in an area or don't have a lot of patients that identify as Aboriginal or Torres Strait Islander, this is something you may have never actually come across. And that's why, again, I'm really keen to go through it tonight. And again, those resources I had at the start of the show and in the description link through to some of this stuff as well. So there is a specific Indigenous health assessment item that can be done every 9 months. Most health assessments are locked in for every 12 months because we know there is inequity in healthcare towards Aboriginal and Torres Strait Islanders. There is a higher frequency that is permitted by MBS to bill that item number. And set aside some time because it is rigorous. And I would encourage you to follow through to the resources for people to support page, because it's actually very, very extensive. They've got some absolutely brilliant templates there. They're in locked PDFs, so you can't just copy and paste them, unfortunately. But I will often print them out, fill them out by hand, and then scan them into the records. I would have loved an electronic solution, but there we go. There are some ones you can load into things like best practice, but not the same. So you won't need to know for the exam, but I thought I'd pop it into here for your own knowledge. This is MBS item 715. Now, if you think to all of your care plans and preventative health kind of measures, there's always that initial part and then that follow-up. And so there is the follow-up provided by an Aboriginal or Torres Strait Islander health practitioner or practice nurse on behalf of a GP, and by an Aboriginal or Torres Strait Islander health practitioner or Aboriginal and Torres Strait Islander health worker with referral from a GP. So these are other people in the practice that can provide those ongoing services, and they are up to 10 follow-ups per year. Tied in as well is a health heart assessment. This is item number 699. You get one annually. And the tricky thing with this is I didn't want to put in your standard kind of chronic disease management plan, which wouldn't be a more preventive health screening kind of thing. There's no mention of kind of chronic diseases here. But I do want to flag, though, that Aboriginal and Torres Strait Islanders do get an additional 5 EPC referral visits on those plans compared to non-Aboriginal or Torres Strait Islander people. So something really, really good to keep in mind. And again, it's about trying to address that inequity in healthcare for those populations. So as you've got here, a cardiac health check, fantastic. Sexual health check, I don't think you would get the item number for that one put through. And visual acuity testing, good point. Possibly. I think you would probably be better off putting the Indigenous health assessment item number, though, as a safer bet. 715, fantastic. And remembering as well, these are clinicians marking the exam. So if they see 715 there, they're going to say, yeah, Butte, you know exactly what you're on about there. Heart health check, fantastic. And GP management plan, yeah, 2 out of 3 is good enough. I'd be happy with that one too.